Good afternoon, Joint Chiropractic employees. My name is Bernard Rubenstein. I want to welcome you to your 2024-2025 United Healthcare Open Enrollment. Looking to enroll or make changes to your healthcare benefits? Now is the only time of the year when you can enroll or make changes to your healthcare plans. Today, I will be reviewing your United Healthcare choices, how your program works, who's eligible, review your voluntary benefits, and how to enroll. The Joint Chiropractic offers a customized benefits package enabling you to design your own plan, to choose benefits that fit your own needs and your budget. The Joint Chiropractic has set up a contribution level. The rest is up to you. You decide what you can afford to spend. Through payroll deduction, choose from 4 health plans: dental, vision, telemedicine, supplemental health plan, voluntary life, accident, critical illness, hospital indemnity, and short-term disability. The contributions you make towards your employee benefit plan are deducted on a pre-tax basis. This automatically reduces the net cost of these benefits to you by lowering your taxes and increasing your spendable income. So let's talk who can enroll. Employees working at least 30 hours a week can enroll. A legal spouse or registered domestic partner and children under the age of 26. When can you enroll? If you're a new hire, you can enroll within 60 days of your date of hire. During annual enrollment, which is now, and this is only for United Healthcare, your major medical plan, and within 30 days of a qualifying event. A qualifying event would be any change to your lifestyle. For instance, if you happen to move, if you are getting a divorce, if you are getting married, you have a new child. Anytime you have a change in your lifestyle, then you can enroll. Your benefits for 2024-2025 include your health insurance is through United Healthcare, dental, MetLife, vision, VSP, life insurance, MetLife, telemedicine through Recurrent Health, accident, critical illness, hospital, and disability is through MetLife. Let's take a look at your medical plan changes, which is effective October 1st, 2024. Currently, Joint Chiropractic offers 3 United Healthcare major medical plans: an HMO, a choice HMO, and a PPO. This year, we will be offering a 4th plan. Your HMO allows you to visit any HMO network provider. This provider coordinates your care. HMO does not allow you to visit out-of-network providers. The plan that you're currently on will remain the same. So anyone that's on the HMO plan, your deductible will remain the same at $4,000 individual, $8,000 family. Your out-of-pocket maximum will increase from $6,000 individual to $8,150 individual, and $10,020 family to $16,300 family. Your office copay will remain the same. Urgent care copay will remain the same, and your prescriptions will remain the same. Your choice EPO is similar to a HMO and PPO program. So a choice EPO is in between the HMO and PPO, whereas the choice allows you to visit any HMO network provider. However, it does not include out-of-network benefits. So your HMO, you need to see your provider to coordinate your care. A PPO, you do not need to receive a referral to visit any provider. A choice allows you to visit any provider, but it has to be in the HMO network. For those that are on the choice EPO or the HMO, your annual deductible will remain the same. Your out-of-pocket maximum will decrease from $8,500 individual to $8,150 individual. Your family deductible will go from 17,000 family to 16,300 family. Your office copays will change from $40 copay for the primary care physician to $25 copay. Specialist will go from $80 copay to $75 copay. Urgent care will remain the same. Prescription drugs will remain the same for the generic. Brand will decrease from 65 copay to 35 copay. Non-formulary will decrease from 125 copay after the deductible to $75 copay. However, there will be no deductibles. Specialty copay will remain the same, but with no deductible. For those of you that are on the Choice Plus PPO, again, allows you to visit any network or non-network provider. Your annual deductible will remain the same, $4,000 individual, $8,000 family. Non-network annual deductible will change from $10,000 individual down to $8,000 individual, and family from $20,000 down to $16,000. Out-of-pocket maximums will remain the same. Office copays will change from $30 primary care to $25 primary care copay, and specials will actually go from $60 copay to $75 specials copay. Urgent care will remain the same. Prescription drugs, generic, will remain the same. Brand will decrease from 65 copay to $40 copay. Non-formulary will remain the same, but with no deductible. And specialty copay will change from $250 copay to $300 copay, however, with no deductible. Again, we will be adding a fourth plan, which is the same as the Choice Plus PPO plan that you're on now, except a few changes of the deductible and copays. The annual deductible now will be $2,000, $4,000 family, and non-network $4,000, $8,000 family. Again, this is a new plan. Out-of-pocket maximum, network is $2,000, non-network is $4,000, family $4,000, $8,000 family. Office copay, $25 primary care physician copay, $75 specialist. Urgent care is a $50 copay. Prescription drugs, $10 generic, $40 brand, $125 non-formulary, and $300 specialty drugs. Again, no deductibles. So basically, on all four plans, there will be no deductibles where there were deductibles for this year. Just to give it a little insight how the deductible and coinsurance works. For instance, if you're on the PPO plan and you have a deductible of $2,000, and let's say your out-of-network benefit is $4,000 for the family and $8,000, I'm sorry, and $20,000 for the family, your deductible will come first. So if you happen to go into the hospital, your deductible will need to be met first, and then your out-of-pocket maximum will be next. So it's going to be based on a percentage of the services up until you reach your out-of-pocket maximum. Here are the 4 plans, a little more of a comparison for you. Again, the Navigate HMO, you will need a referral. Your Choice EPO, you do not. Choice Plus, both plans, you do not need a referral. Your Navigate HMO deductible is $4,000, $8,000 for the family. Coinsurance, 20%. Out-of-pocket maximum, $8,150 and $16,300. Again, like I was explaining, if you happen to be as an inpatient hospital stay, your deductible of the $4,000 will need to be met, and then the 20% up until your $8,150 for the out-of-pocket maximum. Routine preventative care is covered 100%, and then your diagnostic testing, outpatient, inpatient, emergency room, all will need to have your deductible and coinsurance met. Emergency room will also include a $300 deductible per visit. Urgent care, $25 copay. Prescription drugs, as I explained, generic $10, brand $35, non-formulary $75 copay. The Choice, which again is the plan that's in the middle of the Navigate HMO and the Choice Plus PPO plan. The Choice, however, you do not need a referral, but you will have to visit any provider in the HMO network. Deductible, $6,000 individual, $12,000 family. Coinsurance is 30%. Out-of-pocket maximum $8,550 and $16,300. This plan has a $25 physician copay and a $75 specialist copay. Routine physicals are covered 100%. Outpatient diagnostic lab x-ray and MRI, CT, PET exams, outpatient surgery, inpatient hospital stay, emergency room, all have deductible coinsurance. Again, the emergency room also includes a $300 per visit deductible. This plan also has an urgent care copay of $50, prescriptions, $10 generic, $35 brand, and non-formulated $75. The Choice Plus, 2 plans. First plan is a $4,000, $8,000 deductible, 30%. Out-of-pocket maximum, $7,500 and $15,000. The second plan has a $2,000, $4,000 deductible, coinsurance 30%. This plan has a lower out-of-pocket maximum of $4,000, $8,000. Office visit, both plans $25.75. Both plans have the routine preventative care covered 100%, and the deductible coinsurance of 30% after deductible for the diagnostic testing, outpatient, inpatient, and emergency room. Emergency room, again, also includes a $300 deductible per visit. Both plans have an urgent care copay of $50, and both plans also have the prescription drugs of generic $10, brand $40, and non-formulary $125. Again, these are your options through United Healthcare. The voluntary benefits, which we will be reviewing next month for a January 1st effective date, include dental. You're going to have 2 options for your dental. Option 1 is a $50 individual, $150 deductible for the family. Benefit maximum is $1,000. Preventative services are covered at 100%. Basic services covered at 80%. Major services at 50%. And orthodontia covered at 50%. The difference between option 1 and option 2 is both plans are the same. However, the benefit maximum on option 2 is doubled at 2,000, and the orthodontia is doubled also at 2,000 for a lifetime maximum. Vision also offered 2 plans. Both plans are similar. Both plans have a $10 copay for eye exam once every 12 months. Option 1 for glasses has a $25 copay once every 24 months, and option 2 is once every 12 months. In addition to visiting your ophthalmologist or your optometrist, you also have a choice of retail chain providers through Costco, Vision Works, or Sam's Club. Supplemental life, you can choose up to 150,000 or 5 times your annual salary. You can also select coverage for your spouse up to 50,000 or 50% of your employee amount. You can also select up to 10,000 in increments of 2,000 for your dependent children. Evidence of insurability is not required when you're first eligible. If you didn't select when you were first eligible and you decide you want to purchase additional life insurance, you will have to answer health questions. Telemedicine, if you're selecting or if you're enrolled in one of the medical plans, you do not have to select the telemedicine. The next time you're sick, you have options. Let's say you're at work and you can't visit your primary care physician. Call your referral health telemedicine doctor, provide them with your symptoms. They'll give you a diagnosis and they'll even call in a prescription. You can connect by phone, video, or app, and it's unlimited use for all family members. The doctors can treat many medical conditions, including cold and flu, allergies, bronchitis, sinus, ear infection, and much more. For those of you that are looking alternative to the cost of the United Healthcare plan, you can enroll in a supplemental medical plan, which is through the SBMA Elite Care healthcare plan. This does coverages only through the network. Routine preventative services are covered 100%. Primary care visit, $15 copay, as well as specialist visit. Urgent care, lab tests, and x-rays are a $50 copay. Telehealth is included. Prescription drugs, generic, there's 4 tiers. Tier 1 is a 15 copay. Tier 2 is a 30 copay. Tier 3 is a $50 copay, and Tier 4 is a $75 copay. Brand drugs and specialty drugs are not covered. In addition, the inpatient, outpatient, emergency services are not covered, but we do offer a hospital indemnity plan, which you can package with the Elite Care plan. The hospital indemnity, we offer 2 plans. Benefits cover both injuries and sickness. Benefits are paid for inpatient and outpatient medical treatment received in a hospital, emergency room, and physician's office. Additional benefits include surgery and anesthesia services, major diagnostic exams, rehab facility, and also lodging. Now, again, this plan, this hospital indemnity plan, is paid to you, the employee, and not the provider. Again, if you have a catastrophic type of plan or a service and you're looking for a expensive bill, this hospital indemnity plan will not cover your full service. It will help towards your deductible or out-of-pocket expenses. And again, this hospital indemnity plan can also be added to the Elite Care or your United Healthcare medical plan. Another available option is your accident plan. Covers accidental injuries regardless of any other insurance. Benefits are paid for both inpatient and outpatient treatment. Covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment, physical therapy, in addition to those benefits that are covered. The plan also pays a lump sum for fractures and dislocations. The next option is a critical illness plan. This plan pays a lump sum benefit upon critical illness diagnosis. There are 20 critical illnesses that the benefits are payable for. You can choose between 10,000 or 20,000 benefit amounts. Also, you can select for your spouse and children. Critical illness benefits are payable for cancer, heart attack, kidney failure, major organ transplant, Alzheimer's disease, Parkinson's, and multiple sclerosis. Again, there are over 20 different critical ill benefits. Short-term disability. This plan will pay a maximum weekly benefit up to $1,500 or 60% of your pre-disability earnings, not to exceed the $1,500. Benefits begin after 14 days accident and 14 days sickness. Basically, the plan will begin on the 15th day. Benefit duration is up to 26 weeks. So let's talk about how to enroll. You should have received, or you will be receiving, a link from our office to access your web enrollment. For those of you that are currently enrolled, you should have received an email and a text from us letting you know that now is the time to access your enrollment. You will need to go back onto your ease portal, your profile, complete your registration, verify your personal information, add any dependent information if you need to, or make changes, and then begin the enrollment process. For those of you that are not on the United Healthcare plan, this is the time to enroll. For each benefit, you choose the coverage level. This is, again, only for United Healthcare. You will need to either enroll or waive your coverage. Once you're done, you will have a pop-up that will allow you to e-sign your enrollment form. Remember, this is for, excuse me, open enrollment, United Healthcare only. Deadline is September 27th. There will be no extensions. Those of you that do not enroll or waive coverage, anyone that's on the current plan, the HMO plan, will be moved to the Navigate HMO plan. Anyone that's on the Choice HMO will be moved over to the Choice EPO. Anyone who's on the PPO 4,000 plan will be moved over to the Choice Plus. So I encourage you to go onto your profile, your ease profile, and go through the United Healthcare open enrollment. Additionally, open enrollment for the voluntary benefits, which is the dental, vision, life, etc., will take place in November. A notification with further details will be sent out next month. I want to thank you for participating in our Joint Chiropractic United Healthcare open enrollment. Good afternoon and have a great rest of your day.